everyone. So I have another guest with me today. You may have seen her on some of our social media posts, and if you're a patient of ours, you've definitely seen her. This is Shawnee. She is a resident who has been with us for the last 12 weeks. This is her last week with us, and we're so sad. But I wanted to take this opportunity to bring her on here and ask her a few questions from her point of view as a resident. So, Shawnee, why did you choose Pelvic Floor as a place to do one of your internships?
I chose pelvic floor because about 7 years ago, I had some pelvic floor dysfunction myself, and I just became so fascinated by all the techniques that we were using in therapy and then the progress that I had. It had such an impact on my life negatively, and then going through therapy, just fixing all the issues, it was life-changing.
Okay, good. And then why did you choose us by OptimaLiving?
Well, y'all, Arizona is hot, okay? Texas is hot too, but there aren't very many pelvic floor occupational therapists in Texas. So I reached out to one. She wasn't able to take a student, but she knows Melissa.
Oh, yes. Yep. So, Tiffany, right?
Yes. And that's how I got hooked up out here with OptimaLiving.
Okay, yes. A shout out to Tiffany Lee in Texas. I think she's in the Austin area, right?
Yes. San Marcos.
Yes, that's right. And then what is your favorite thing about treating pelvic floor dysfunction?
There's so many things. I really enjoy the personal aspect of it.
It is very personal. That's true.
As I remember when I went to my first therapy appointment, honestly, I was dreading it. But just kind of the rapport that's built as you go through therapy, it makes it not so bad.
Yes. And on a side note, you've experienced that from a clinician point of view as well.
Yes. And it's just made me fall even more in love with pelvic health. So that's a big component.
Okay. And then what's your favorite thing about our clinic?
Oh, everything? Is that an answer? Is everything
that's
an
so
answer?
nice.
I love the solidarity of all the clinicians and all the staff. Everyone here has been so helpful in my journey. I love our patients, of course. I also love that the clinic is holistic. So we bring in so many different components, and I feel that other clinics that I've seen or heard about from my other classmates, they're not covering all the topics. They're not looking at some of the psychosocial impacts that these illnesses or dysfunctions or injuries have on their patients. So I'm very grateful that I got to do both.
Good.
Yes.
And then what are you going to do with this in the future? What are your plans? What's next?
Ooh, so many things. I hope I'm going to return to Texas. And
Unfortunately. I mean, she has a husband and everything, but still. Man.
I am going to go back, and I hope to continue pursuing pelvic floor from an occupational therapy standpoint.
Yes.
So I'm very excited.
Perfect. All right. Thank you, Shawnee.
Yes.
I really appreciate it. Okay, I hope this was helpful for you guys. If you have any questions, feel free to reach out, and we'll talk to you soon. Bye.
Bye.